Hi everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. One of the most common scenarios that I deal with is looking at a medication list. Usually it's in somebody over the age of 65. And I kind of shake my head. I think, oh my goodness, what are you on? So many different pills, many of these are not needed, and we have to de-escalate these in some way. In my opinion, it is a national, probably an international scandal how we drug up our senior citizens, and as well as causing side effects and adverse events, it is a huge cost issue in many countries, especially the United States. I deal with it every single day. And this is not direct medical advice. I'm going to go over some of the common classes of medications that can be de-escalated. Obviously, if I'm not your doctor, I can't give you direct medical advice, but I can guide you so that you can go to your doctor and hopefully, if appropriate, some of these medications can be weaned down. A lot of them shouldn't be abruptly stopped, but they can be weaned over a few weeks or months. The statistics are absolutely staggering. 90% of everybody over the age of 65 is on at least one prescription pill, and 40% are on 4 or more. Obviously, this number goes up with each passing year. And medications don't have to be what I call a sentence for life. Many people, even in their 40s or 50s, are prescribed a medicine and it stays with them forever, usually inappropriately and without the supporting evidence that this medicine should be an ongoing thing. This problem affects tens of millions of people out there, and I wish that more in the medical profession had the philosophy that pharmaceutical products should be used only for the shortest time possible. And hopefully, if lifestyle measures are adopted, if there's a motivation to do that, then people won't need the medications forever. Because my philosophy when I look at any medication list is to think to myself, how do I get my patient off some of these medications? That is the way that I personally think I want to do that, because the human body is beautifully designed. Whether you believe in God, nature, or anything else, your body is perfectly crafted, and it is not natural to pour chemicals into your body. So here we go then, some very common classes of medications that can be successfully de-escalated or even stopped in many over 65s under the right medical supervision. Number one, a statin medication. How many millions of people out there, tens of millions of people, are on statins? And what my advice would be, if you're in your 70s or 80s, go to your doctor. If you've been on this medication for some time, ask your doctor what the true evidence is behind statins in your age group. You might be surprised with the answer, assuming your doctor even knows this, but remember, in the medical profession, we're all about following the science, supposedly. So ask your doctor what the science is. What do these studies actually show? And you might be surprised with what the real answer is, and then you will be able to make your own personal health decision. Because there is evidence that when we pile statin medications on people, there can be detrimental effects. Of course, we fix the number and get very excited that we lower the LDL, the quote-unquote bad cholesterol. But what does that actually mean, especially into old age? Because your body, especially your brain, does need fat. And cholesterol is a crucial part of your cell membranes. And research is now suggesting that if we're too aggressive, if we lower the LDL cholesterol too much, then that can be associated with negative outcomes, including certain diseases, inflammation, or even dementia. And that makes sense logically. So do have that discussion with your doctor. Number two, blood pressure medications. I've talked about this many times before. We have a big problem in medicine. We overload many millions of people with blood pressure pills. And a common scenario is this. Someone in their 70s, 80s, or 90s will be on 2, 3, 4 blood pressure pills, and as they get older, their blood pressure naturally drops. Throw in an illness like a respiratory infection, throw in them not eating or drinking for a few days, and their blood pressure can often drop dangerously low, and they keep on taking their pills. What I would advise is that anybody over the age of 70 review your blood pressure control with your doctor at least every 6 months. Ideally, check your blood pressure at home, because you might be surprised you're running at a low blood pressure, and even if you're not sick, this is going to predispose you to feeling dizzy, to even passing out, falling down, and on a logical level, if your blood pressure is low, you're not getting enough cerebral perfusion. you're not getting enough oxygen to your brain. And my strong hypothesis is that if this was actually studied, having a low blood pressure in old age is associated with neurocognitive decline. Very sad situation indeed. Many millions of people out there are in this situation, all because medications, blood pressure pills, have been piled upon them. Number 3, muscle relaxants and neuropathic pain medications. This could encompass a number of medications, including Flexeril or gabapentin. Don't get me started about gabapentin. I see so many issues with that. But I see a lot of older patients who are on whopping doses of these medications to relax their muscles and to also help with neuropathic pain. And the problem with these medications is that they can make older people very drowsy, lethargic, prone to cognitive changes, even falling. And frequently, we will see patients admitted to hospital on these medications, and because of their acute condition, we've had to cut back or even hold the medication, and the patient hasn't even complained about worsening symptoms in their muscles or neuropathic pain. And that just shows that they may have not even needed the medication in the first place. Again, this is highly individual. I'm not saying everybody doesn't need the medication, but I find a lot of older people are on high doses of these medicines, and they can be safely de-escalated with no exacerbation of these symptoms which cause them to be placed on these medicines in the first place. And they've been increased for many years. I mean, gabapentin, my goodness, the number of issues I've seen with that medicine, I cannot tell you. Number 4, antidepressants. I could talk for a long time on my thoughts on antidepressants and the true evidence behind them and what the medical industrial complex has done over the last few decades. In fact, I could give you a 3-hour lecture on that, presenting to you real evidence, because the benefits, especially for mild depression, are nowhere near as much as the pharmaceutical companies and the medical industrial complex might suggest. And a very common scenario that I see is, again, this is getting back to a life sentence for medications. Many people who are younger, in their 40s or 50s, may have been put on an antidepressant and they stay on it. And in their 60s, 70s, and 80s, they're still on this medication, and they've asked me how they can get off it. And I've recommended weaning down slowly, which they've done and then successfully stopped in many cases, and they have noticed no rebound at all in their depression symptoms. They probably didn't need it for many, many years. And antidepressants are not without side effects. They can cause very unpleasant effects, anticholinergic side effects, and they can also interact with lots of other medications. So they are not a benign medication. No medication is. Number 5, thyroid medication. Many millions of people out there are on pills for reduced thyroid function. It could be levothyroxine, Synthroid, and they're on these medications for many years. And a frequent scenario I see is an older patient, usually female in their 80s or 90s, and they've been on this thyroid medication. We check their thyroid function and they're being way overtreated, and we are able to de-escalate their thyroid pill. A bit more difficult to stop the thyroid pill completely. It can be done sometimes, but nevertheless, this is a problem, I don't doubt, for many people out there. And this is also an issue of you having a good doctor who keeps your thyroid function under good surveillance. You need to have regular thyroid tests to make sure that you're on the right thyroid medication and you're not being overtreated. The thyroid gland, of course, is very important and plays a role in many metabolic processes within your body. Number 6, diuretics. This overlaps a little bit with the blood pressure pills, but many millions of people out there are on a diuretic medication like furosemide, Lasix, to drain fluid out of the body. They may have edema, swelling, they may have some fluid buildup on their lungs, or they may have another condition that requires them to take the diuretic. But I see many older patients who are overtreated with furosemide. Obviously, I deal with them more in the hospital, and if they're coming in with an acute medical condition and they're dehydrated, then we have to cut right back on it. But even after they leave the hospital, I notice that a lot of patients do okay on a reduced dose of furosemide. They've aged, they no longer need the medication in such high doses, they don't have swelling, they don't have a lot of the other problems, and the diuretic medication is causing a lot of other potential issues. It's causing them to lose fluids and drop their potassium and sodium levels. So that is certainly a medication which can be de-escalated in many people successfully. So there you go then, 6 classes of medications that can successfully be de-escalated in many millions of people. Number 1, statins. Number 2, blood pressure, antihypertensive medications. Number 3, muscle relaxants and neuropathy medications. Number 4, antidepressants. Number 5, thyroid medications. Number 6, diuretics. I really do believe that the vast majority of people over the age of 65 who are on multiple medications, what we call polypharmacy, can successfully have a significant number of their medications de-escalated or even stopped. It's a very sad situation for millions of our older citizens, and once more, this is not only a case of preventing side effects, adverse events, interactions, it's also a huge cost issue. Who wants to spend money on medications if you don't need to? So I really hope that if you or a loved one is in this position, you can have a discussion with your doctor about what you can really successfully get off. Get off medications. Your body is not designed for medications. You only should take them when absolutely necessary. Do not become a statistic, and do not let pharmaceutical companies profit off your body. Thanks everyone for watching. Feel free to comment down below. Share your stories of excessive medications and drugs that you've been successfully able to get off. If you feel comfortable, do comment down below. Check out my website and my free downloads. Those links are down below. Hit the like button if you like this video and the bell button for more similar videos in the future. That really helps with the algorithm and getting these videos shared as widely as possible. We will speak again very soon.